Hi, my name is Braglia, and I'm a speech therapist here at Morris Hospital. And today I have Alicia Funk with me. She is a social worker here at Morris Hospital. I wanted to reach out to our community, especially since we haven't been able to have our stroke support group. And I wanted to give you guys some information that I know you have requested in the past. And I figured today would be the best day to do it. So from now we'll just get started. And I'll start with some questions that we typically have at our stroke support groups. What is the difference between Medicare A and Medicare B?
So Medicare Part A is going to cover any inpatient hospital stays, skilled nursing facilities once certain qualifications are met, hospice care, and some home health care. Medicare Part A is usually free of charge for anyone 65 years and older, also based on that person's employment history and someone's spouse's employment history. And Medicare Part B is going to cover any outpatient services. This is usually like outpatient doctor services, any durable medical equipment that somebody might need, and preventative services. There is usually a monthly premium and a yearly deductible with Medicare Part B. And then neither of these cover any medications, dental or vision care, so an individual would need to purchase an additional insurance plan to cover medications, vision, and dental if needed. There is also an option to do a Medicare Advantage plan or Medigap program. Again, this is something that the individual would have to purchase and kind of choose to see which service would be best for them. These Medicare Advantage programs usually cover what Medicare Part A and the coinsurance of Medicare Part B would cover, and then some of them do offer medication programs and dental and vision insurance as well.
Oh, very interesting. Is there anybody to assist people to get these plans?
Yes, we do have a SHIPS counselor. That's the Senior Health Insurance Assistance Program, available free of charge to provide local, in-depth, objective insurance counseling. I know a lot of people probably aren't too familiar with that, but there is a phone number for the SHIPS coordinator, and that's 1-800-252-8966.
Well, I know that a lot of people could use that help, so thank you for that. Mm-hmm. What is covered by Medicare for nursing home placement and home health and outpatient care?
So Medicare Part A will cover a skilled nursing facility for the first 20 days at 100%. That person does need to have a scalable need, whether that's for nursing or physical therapy. And then in addition, in order for Medicare to cover it, a patient has to have a 3-night hospital stay as an inpatient. So if a patient were to be here under observation, that would not count towards their 3-night stay for Medicare to cover it. After day 20, there is a copay that the individual would either have to be responsible for, or if they have a supplement insurance, most insurances will pick up that copay. And I know in 2020, the copay was roughly about $185. So Medicare will pay up to 100 days for a patient to have a skilled nursing facility stay, as long as they have that scalable need.
Very good. So when does that 100 days start over?
For Medicare Part A, the 100 days will start over once a patient is out of the hospital as an inpatient and out of a skilled nursing facility for 60 consecutive calendar days. Oh. Then they will restart and have, again, 100 days available. So, you know, it's kind of nice because patients who might need to have a skilled nursing facility stay multiple times throughout the year, they have that opportunity.
Oh, very good. When does my Medicare B start over?
So there is no general cap for Medicare Part B for outpatient services.
Okay. For PT, speech, and occupational therapy, we do start over with our budget, and that is January 1st of every year. And so with that, physical therapy and speech therapy share a budget or a cap, and occupational therapy has their own. But as long as we can show that you are making progress and that you're benefiting from skilled intervention, we can go over that amount. So it is important that we work hard and the patients work hard on the things that we give them so we can continue to see them and they make progress. And then hopefully with that progress they made, they won't have to come back again within that year. But sometimes things change and things happen. But as long as we can show progress, we can continue to see those patients. So another question that we have are, how do supplemental plans work and are they worth it?
So you can purchase a policy from an insurance company that is licensed to sell from the state. Most Medicare plans or a Medigap plan, Medicare Advantage, will cover any Part A or Part B coinsurance and the deductible for Medicare Part A. So you must determine if the Medicare plan is appropriate for you. So if you go to the Medicare website, you can kind of choose the straight Medicare and then click and choose to compare supplement plans to see which one's going to offer the services that you need. So it's kind of nice to see it there and determine which plan will be best for you.
So the next question that I get a lot from family members, and even I've gotten some from friends as well, can a family member get paid to be a caregiver?
So a family member can become a family home care aide. This is through the community care program. However, this is a program that is based on financial eligibility. So an individual would have to kind of go through and make sure that they qualify for care at home and for the family to become their caregiver. So this is an option. There's just a couple steps that need to happen before they can automatically be getting paid to care for their family member.
Okay, very good. So we know that there's a lot of available resources within our community, especially during this pandemic. One of them is Meals on Wheels, and I get asked a lot of questions. How does it work? Meals on Wheels is a community-based nonprofit program providing seniors ages 60 years and up nutritious meals free of charge to their home. While this is a free program, they do accept donations. I think it's great that our seniors can have this option here in the Morris community. Sometimes there are waiting lists for seniors to have Meals on Wheels services just because it is a free service, so a lot of people are trying to utilize that, which is great. So once you get on that waiting list, we'll just kind of get those services available to our seniors as soon as we can. Wonderful. Another question that we get asked, and especially patients that have had strokes or have limited transportation, is there transportation available for these patients to get to appointments or other things that are needed? Yeah, we have several transportation options here in the Morris-Grundy community. The first would be the Morris Hospital van. This is available for any Morris Hospital patient. They transfer straight from the Morris Hospital to any outpatient clinics affiliated with the hospital. So they run Monday through Friday up until 4 o'clock. And if a patient is here in the hospital, if they're a stroke patient and qualify to go home on the hospital van and they live within the Morris community, we can set them up on the hospital van and they can get a ride home, which is great. In addition, there is the Senior Morris van, which again runs within city limits. And this is a van that runs Monday, Wednesday, Friday. And it's 25 cents one way, so it's really affordable. So the next option is the Grundy Transit van, and this runs within Grundy limits. If an individual needs to be transported in the Grundy community, it's a $3 fee one way. And then this van also runs to Joliet 3 times a day, and if somebody needs to go to Joliet, it's about $4. Okay, wonderful. Another question that we have is, what is the lending closet? What do they do and what do they offer? The Grundy Community Lending Closet is another free service here within the Morris community. So this is a lending closet that offers free durable medical equipment to be loaned out to patients who might need it. So if we have a patient who might have had a stroke in the hospital and they need a walker for a short period of time, they can borrow a walker from the lending closet and use it until they no longer need it, which is really awesome. For our patients here who might not have insurance to cover any medical equipment, they do have the option of getting it through the lending closet. In addition, the lending closet also has any adult diapers or wipes and things like that that somebody might need. They also do accept donations for any durable medical equipment that you might have at home,
and if you no longer need it, the lending closet will certainly take those donations.
Oh, wonderful. Thank you. The next question that I get from some of our support group members are, how do I go about getting a caregiver or a homemaker at home?
So there are caregiving options that case management would be able to provide resources for. Any caregiver services is a private pay service. So this is something that individuals would have to pay out of pocket for. In case management office, we have a list of services with different caregiving agencies, and the individual would be responsible for calling that company to see if they are able to provide services that the family needs based on hours and needs and all of that, and location as well. And this is a service that is paid privately through the family and individual.
Oh, wonderful. So as of right now, I know we are limited on having guests and people at the hospital coming in groups. So our stroke support group has unfortunately not been able to meet in person, but this is a way that we're trying to reach out to you to get you some information, especially things that you've asked about in the past. As of other counseling aspects, I know our local physicians can offer some areas where you can get counseling, whether it just be some counseling that they could provide, or they can assist you with maybe seeing a psychologist or something of that nature. But again, we miss seeing you here, and we hope that we get to meet again real soon. And it's been a pleasure being here with you today, and thank you, Alicia, for helping us with this.
Thanks for having me.